You just heard the speaker. I want to pick up with what she said. She says a public option in health care reform is, in her view, non-negotiable. Can Senate Republicans sign on to a plan that includes a public option?
I think I can pretty safely say there aren't any Senate Republicans who think a government plan is a good idea. We have 1,300 health insurance companies now, robust competition among them. We know that if we create a government plan, there won't be any more private health insurance companies, and there won't be any competition. We have a good example of that, John, already in the automobile industry. That's exactly what would happen in the healthcare system, and I think people on my side don't like it. And you know, it's interesting, the Democrats are having a hard time selling it to their own members as well.
Well, let's talk about another issue on the table. You say public option, non-starter with Senate Republicans. How to pay for this is another big thing. As you know, the House bill has a surtax on wealthy Americans. I know you don't like that. One of the things they're talking about in the Finance Committee, where a few of your members are involved in the negotiations, trying to find some bipartisan ground, is this so-called Cadillac insurance plan tax, that you would tax the most lucrative insurance policies that give way above average benefits. You okay with that?
Well, some of our members think that that's a reasonable way to go, but all of our membership is in a meeting every Wednesday afternoon in which Senator Grassley and Senator Enzi give them a rundown. Senator Grassley and Senator Enzi give me a report on a daily basis. And
what is the extent of their promise to you?
Well, we have to see what they come up with. I mean, I think I don't believe either one of them are going to sign on to a package that the vast majority of our members think is a bad idea. Our idea of bipartisanship in the end is not just talking. It's what do you do, and what kind of proposal is it? What is the policy?
Well, on that point, I want to step back in time. After the election, as President-elect Obama was preparing to come to Washington, you gave a big speech at the National Press Club where you laid out your views on what was likely to happen. And among the things you said was this.
We fully expect to be a full partner in developing major health care reform.
Might sound a little cynical, but how's that going?
Well, I think we will be at a certain point.
You will be. You're not now.
John, what's happened now is they can't sell it to their own members.
Right.
As I said a minute ago, the only thing bipartisan so far is the opposition to it. At some point, they understand that in order to comfort their own members and to have broad support among the American people, it will need to be bipartisan. So far, they have produced a measure that they cannot sell even to their own members.